Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. This week's blog is called 20 Things Heard in a Chiropractic Office. This is part one. When I wrote it out, it was way too long to keep the attention of a reader, so I broke it down into 4 parts. So here's the first 5 questions of the 20. Okay, number 1, wiggle your feet. Okay, what would that be? This one seems silly, but patients are commonly somewhat apprehensive at the thought of having the neck adjusted. Yeah, even if they've done it a million times. You know, it shouldn't work, but it does. Almost every time you tell a patient to wiggle their feet, you know, it takes their minds off of the adjustment just long enough that they're not guarding, and it's so much easier to accomplish. Okay, number 2. You didn't get this way overnight, and I'm not going to get you better in one day. We also call this one, if I could fix you, or if I could fix everyone in one visit, we'd have the vans out at the airport picking people up. You know, this one is pretty obvious. Most patients are very reasonable people. They understand the concept that you're not going to get where you want to be in one visit. It's just not going to happen. Any meaningful change in the body, it just takes time. However, every now and then, you need to have a pretty honest discussion with your patients. Sometimes they just expect immediate results. Although, you know, I've seen immediate improvement, it's more common that lasting pain relief, it takes some time to accomplish, some consistency. Okay, number 3. If you go see a physical therapist, do you think they'll just see you one time and tell you to call them back if it keeps bothering you? You know, physical therapists, they set you up a dependable, consistent schedule. Many times patients, they'll come to us thinking that chiropractors, we just want to see them a million times, and that a recommended schedule of treatment is somewhat unreasonable. So that's why commonly I point out the fact that, again, meaningful change in the body, it takes time. Physical therapists, they recommend a schedule for rehabilitation of a complaint. And some of what we do as chiropractors is physical therapy in nature. So why would we not recommend a schedule for treatment? A regular schedule that is consistent almost always provides results and durability. Also, you can go back up to the discussion on number 2 for a little more thorough explanation there. Okay, question 4. I didn't know I was sore there. So it's common for people to come in for one complaint, but after undergoing a full orthopedic and neurologic exam, come to realize that they're more sore than they originally thought they were in areas of the body they didn't necessarily even know hurt, because they were so focused on the chief complaint that they came in for. So this is exactly why a comprehensive orthopedic and neurological exam is performed by a good, responsible, knowledgeable chiropractor that does his or her due diligence. It's extremely important. Okay, the 5th thing, and the last one this week, that is commonly heard in a chiropractic office is, I hurt everywhere. It's more common than it should be, but patients, they come to see us after years of chronic pain that they've let take over. Pain can literally change a person and take over their lives. Unfortunately, only 10 to 15% of the nation seeks out chiropractic care, so it's common to see people after they finally had enough. These are the people that hurt everywhere. So those are the 5 common things heard. We'll bring part 2 to you next week. I hope you enjoy this blog. Make sure that you subscribe to our YouTube channel so you don't miss any of our great videos that we put together here for you. We hope that they're full of great information and that you enjoy and share them with your friends and family. Again, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. And be sure and visit our website for more information on us. It's creekstonecare.com. Thanks.